According to a January report by the Bipartisan Policy Center, 9 states and the District of Columbia have enacted paid family leave programs. A paid family and medical leave program in Minnesota has been a goal of Senator Susan Kent for several years now, and she joins me to talk more about it. Welcome.
Thank you. It's good to see you, Shane.
The Minnesota Senate passed paid family medical leave back in 2016, but the House did not take it up. I spoke with you about the bill again in 2019, so here we are. Another 3 years later, it seemed time to revisit this. Why do Minnesotans need a paid family medical leave benefit?
I think you can ask any Minnesotan that question and they'll give you a good answer, and there are a lot of them. If they have a baby and they need time off from work, we know that about 25% to 33% of mothers who give birth have to go back to work within 2 weeks of giving birth. Nobody chooses to go back to work 2 weeks of giving birth, and this is the only way we're really going to get at that. If you have a serious illness, and you need serious cancer treatments, say for example, that sideline you, or you have a serious injury, or you have an ailing elderly parent and you need to be there for them and to care for them. Any of these are just some examples of why Minnesotans need this benefit.
As I mentioned in the introduction, there's a growing list of states that are adopting some kind of paid family leave benefit, and each state operates differently. What, in general, are the startup costs likely to be? How long until it's fully functional? If it would become law, how long until we achieve, sort of a regular benefit that people could take advantage of?
If we were there, and there have been several different proposals, and my bill has not had a hearing, so we've not been able to really debate and discuss and amend to address some of these questions. But because that's the purpose of giving bills hearings, so that we can do that public process. But one of the proposals is that people would pay into the fund for 2 years and then it would be fully operational. There are other options. For example, it's been proposed we could use some of this surplus money, one-time surplus money, to just get it started, and it would take some time to get it literally implemented and up and running. But pretty quickly, maybe a year, we could have people taking advantage of this.
In essence, the state would be creating an insurance plan that all employees would pay into, and that then anyone could dip into for a qualifying event. As you said, the birth of a child or the adoption of a child or caring for a seriously ill loved one, and still get paid. What level of wage replacement are we talking about?
It depends. It's on a sliding scale, so that it's up to 90% if you are at the low end of the pay scale, so you get almost all of your payroll, your income taken care of, covered by this benefit. And if you make more money, it's down to, I think, 45 or 55%, and then it caps. So even if you make a lot of, if you have a really big salary, you're not going to get 45 or 50% of it. It's designed to support those who really need it the most, who cannot afford to take that time off, either for themselves in a major illness or injury, or for a loved one. And we know that people need to not be put in the position of having to choose that kind of care, or paying the rent, putting food on the table.
Now, you mentioned that people who go back to work right after giving birth, and so I always wonder about people who are part-time, because when I had my children, I was an adjunct faculty member, and so I was not a full-time employee. I didn't have those kinds of benefits. I ended up taking a week for each child. Would part-time workers be eligible for maybe a prorated amount?
Yes, and it is structured to work so that part-time workers have the opportunity as well. And as I had my baby when I was self-employed, and self-employed people can opt into it, and same thing, they can pay into it, and then they can potentially pay somebody to keep doing the work while they're taking the time off.
Some of the larger businesses in Minnesota are already self-funding this benefit for their own employees. And with a tight labor market, that is certainly an attraction for employees, and creating maybe an unlevel playing field then for those companies that already have this. Would your bill preempt their plans?
What the bill does is it says that if you, as an employer, any size, are offering a benefit that meets the standards, the same standards that the state plan would be, you can keep yours. Or if yours is a little short, you can just upgrade yours and meet those same standards. But it does say that every Minnesotan would qualify in their workplace to have access to this benefit and have the option of leave when they need it for as long as they need it, up to 12 weeks, so that they don't have to make that difficult choice.
As you know, Republican Senator Julia Coleman has proposed a measure that would allow businesses, especially small ones who can't compete with these larger companies, to purchase insurance products on behalf of their employees as a way to expand that benefit to more Minnesotans. Could you support this, knowing that it is at least moving the needle forward for more Minnesotans?
First of all, I'm really glad to see that there is bipartisan efforts to try to solve this very real need for Minnesotans. My concerns with these proposals is the way they are. First of all, when you the proposals don't cover everybody. They both in terms of they don't have the medical leave part of this. This is only a family leave plan. If you have pregnancy complications, it doesn't count. Then it's more expensive, because anytime you go through the private insurance industry, it just is a more expensive because you've got a smaller pool. The larger pool of a statewide plan is what brings the cost down for everybody across the board, and then which makes it feasible to make everybody able to receive the benefit. And then the other problem with this one is that it is capped. There's just, if the state were to subsidize this for everybody through this type of a mechanism, we couldn't afford to do it. So it'll be relatively few people who have access to it. The math just doesn't work to make it widely available, and it doesn't prohibit a company like, for example, a major corporation. As we've seen, they will sometimes provide benefits to people in corporate headquarters, but not for folks who are working, say, in the restaurant outlets or in the retail outlets. That would still allow those kinds of picking and choosing to happen.
Now, the one criticism, though, that I have heard from some Republicans is that this proposal is sort of a one-size-fits-all approach, and potentially creates another MNLARS, because it would be a state-run program. How do you counter that?
One of the things I would say is the way that ours is developed. First of all, we have been learning from states that have been doing it. The state of Washington, for example, has a very similar unemployment insurance system that Minnesota has. And so we can model our paid family medical leave program off our unemployment insurance system, and also off the program that Washington State has very successfully implemented. So we don't have to have whole new computer systems. We don't have to reinvent the wheel. It takes advantage of all the great learning of what we know works, and what we know worked through the pandemic. Let's be clear, these states got to kick the tires on their plans and their policies through a historic time, and it worked. And so, we feel like that's pretty good testimonial for what that could do for Minnesotans.
Now, one more thing before we go, because you were elected to the Senate in 2012, and you served as leader of the DFL caucus from early 2020 until last September, when you announced that you were going to retire and you stepped down from your leadership role. What over this decade are you most proud of?
That is such a hard question, because there's so much. I'm really proud of what we've been able to do, really, with DFL leadership, both in the governor's office and in the legislature at different points, in terms of bringing our budget back from a crisis, not having the ongoing surplus deficits, which means we're constantly having to cut for schools and our public safety and judiciary and communities. I would also point to, I will never forget voting for same-sex marriage and what that meant for so many people. And the last one I will say is being able to support student mental health and counselors, school psychologists, and social workers. We made a dent in that, but as we know right now, more than ever, we need to keep doing that.
Senator Susan Kent, thank you so much.
Thank you.